News that India is running out of vaccines is a huge problem for countries like Jamaica. This according to Professor of Public Health and Epidemiology Peter Figueroa. India is one of the major producers of the AstraZeneca vaccine, on which most low- and middle-income countries depend for their vaccination programs. And in being a member of the World Health Organization's COVID-19 vaccine working group, Professor Figueroa disclosed that only 4 vaccines thus far have been approved by the global body. India's vaccine shortage, he says, will slow down Jamaica's inoculation program.
There was already a severe shortage of authorized vaccine available to countries like Jamaica, and with the surge of cases of COVID in India, they have had to divert a good bit of their supply to looking after their own people, which is understandable. But it does mean that the vaccine that we were hoping to get through the COVAX facility is going to be delayed, and it means that it will slow down our ability to vaccinate our population.
He added that 2 of the 4 vaccines approved so far by the World Health Organization are not the best options for Jamaica due to the cold storage requirements. In the United States, the Johnson & Johnson vaccine rollouts was suspended. He says Jamaica should be hoping for further vaccine approval.
So we are hoping that the vaccines coming out of China and Russia will soon be pre-qualified by the World Health Organization so that they are authorized and the COVAX facility can then make them available to low and middle income countries, including Caribbean countries. More candidate vaccines are being developed, but there is a serious shortage of available vaccine for us to access.
And Dr. Andrew Manning, president of the Jamaica Medical Association, mentioned the vaccine challenges facing India on Monday night. He agrees that this means bad news for Jamaica.
That certainly could impact our supplies of vaccines. Hopefully, when some of our closer neighbors achieve herd immunity, one can only hope that the vaccine supply would improve. But until such time, we have to rely on the measures that have been stated, wearing your mask, social distancing, and people need to comply with these measures. So we can't rely on the vaccines for now. We have to do whatever we can do to bring down the positivity rate.
And despite the Minister of Health documenting fewer cases of COVID-19, Dr. Manning believes the positivity rate is still too high.
If you look on this in the context of the number of beds that are occupied, and we're still at 323 persons hospitalized for COVID-19, we definitely are not out of the woods.
And with the recommendation by the World Health Organization, countries should be keeping their positivity rate below 5%. Jamaica's positivity rate, however, is currently 23.2%. Aisha Nation, Frontline News.